Belaku. I have been with Indus Valley Ayurveda Centre since 2010 and I enjoy seeing my patients, or rather we call guests here. Their improvement in their health condition is what we look on an everyday basis. Basically in Ayurveda, we have a unique concept called as the Prakriti, which is the constitution, and every individual is identified with his own unique constitution, which is basically the predominant of one of the doshas. So we address him as like a Vata predominant person, Pitta predominant, or a Kapha predominant. This can be either one dosha predominant, or sometimes it can be a combination of two doshas, sometimes the combination of all the three doshas in the equal proportion. So we are born with this nature, and that remains with us all along our lifespan. So understanding the constitution is the unique feature of Ayurveda, which helps in correcting our lifestyle. Previously, what used to happen is there were more of the diseases that was coming out of infection or inflammation in the body. But these days, it is more like a lifestyle disorder, and understanding our constitution and having a lifestyle framed as per our constitution helps in having a positive health benefit. So coming to understand how we can identify our dosha, this is like a very unique and a very deep science which needs to be done or evaluated by the physician itself. But generally, I can give you a gross properties of what identifies Vata, what identifies Pitta, which can to a certain extent help, but it's like more deeper science beyond this. So people with Vata constitution generally tends to be on the lean side. They have dryness in the hair, dryness on the skin, and they have very erratic or very fluctuating nature, and their thoughts run beyond like what they think. So coming to the Pitta people, they have a good well-built body framework. They are very smart to look at, and they are very workaholic. And coming to the Kapha, they always have a tendency to be a little on the bulkier side, and they are generally slow in their activities. And they are people who likes food, they are little lethargic, and they generally try to stay away from the activity level. This is what gives like a basic features. But beyond this, there are many other factors which needs to be identified by the physician. As an imbalance, he can see more of the dryness of the skin, dryness of the air, the cracking sound in the joints, the joint stiffness, joint pains, having bloating in the stomach, occasional heavy breathing. And as I was telling you, each system has got its own physiology with the three doshas. Whenever there is any imbalance with the movement, it is a disturbance in the Vata. So a person can get constipated if his digestive system is involved, and if the respiratory system is involved, he can have heavy breathing. If it is like Vata predominant in the joints, crackling sounds or early degenerative changes. If the mind is provoked with Vata, then again it is like stressful. And tinnitus is something which affects the Vata people. Tinnitus is more a manageable condition, but Ayurveda, with the concept of the doshas, we have good treatments. For a Vata person, they don't generally have a tendency for weight gain. So with them, putting on weight is a tough thing. But again, they can go in for weight gain provided their mind is stressed. So their mind is stressed. Because of the stressful mind, they go into wrong food habits and wrong lifestyle, which can lead to the weight gain in the Vata person. But there are other features in the Vata person which they need to consider, as in the mind. Their mind is like occupied with too many thoughts, so they need to be more organized in their thought process, and they are more of like anxiety, and they are always airy people, so they need to have more of the grounding principle in them, so which they can focus on. And since they are very erratic, they need to have a proper dinacharya of having like a stable routine dinacharya that they would follow always. We need to advise them to have like less of physical activities, and ghee would be the good option for them. Good self massages every day would help in bringing down the Vata, because we consider skin to be the seat of Vata, and as we know, skin is widely distributed organ in the body, and oil is something which has the opposite properties of Vata. So having oil massages regularly helps in balancing their Vata, which helps in taking care of the Vata imbalance that they are prone for. and for them they need to have a good substantial meal. Prefer more of the grains, pulses. Raw food increases the vata, so they need to avoid the raw food. Getting into the universal principles is not with Ayurveda. It is very unique, very specific for their constitution and for their imbalance. But Ayurveda gives a guideline. It's basically about ahara, vihara and vichara. So the way we eat, the way our activities are, and the thought process, how it is. Having a healthy lifestyle, basically having fresh meal prepared for all the 3 meals, having more of like the energy rich food, not the preserved or the processed food. So freshly prepared food is something that I would advise. And coming to the activities, it is moderation, and this suits for all the constitution people. And then coming to the thought process, calm, relaxed mind, no overthinking, and not to have these arishat vargas, whatever we call as like the increased greed, the envy, the jealousy. So having like a good streamlined thought process and getting into the process of pranayama, meditation can be considered as universal thing for all the 3 doshas. What I advise is to get to know more about the doshas or the imbalance or how they can correct it and maintain the stability. It's always good for them to get into their consultations with the Ayurveda doctors. Though we have varied information on the internet, it becomes like sometimes generalized. The uniqueness is what is more important. So what message I would like to give is, please meet a doctor to design your treatment or the lifestyle. We have been handling patients of almost all the medically treatable conditions here, and definitely when it is the surgical conditions or when it is acute, we do have an integrative approach, and that's what I focus on or believe in the right Ayurveda treatments.